In Southern Africa, the health of young people continues to be limited by high rates of HIV and gender-based violence and low access to health care. Amongst the most marginalized are prison populations. VSO have partnered with Tackle and the Southern African Network of Prisons to implement a 2-year program, scaling HIV and sexual health education through football coaching, which sought to improve the health of current and former inmates and facilitate their reintegration into society.
Vakadzidza zvakawanda like on HIV, on family planning, on STIs, through those drills dzavaita idzodziya dzemasports. It was so interesting kuti munhu aita achifunga kuti masports, but at the end of the day owana kuti atova knowledge on those things like HIV and AIDS, ndoma STI, oti family planning.
Inmates are trained as volunteer peer educators on sexual health, how to prevent and treat HIV, gender equality and non-violence, and much more. Tafazwa Sekeso is with SANOP. He explains the work implemented in 14 prisons in Malawi, Zimbabwe, and Zambia.
The idea was that they would use football for health to make it interesting for the inmates to be able to remember, and an interesting way to be able to convey the message and also have fun while they're also doing it. And for the officers to be able to find a way to relate with the inmates as well, so that when they do talk about sex and reproductive health issues, it's easy for them to be able to convey the messages to them.
The program trained 126 inmates as peer football coaches. In turn, they reached 2,920 inmates and ran over 1,047 football sessions with sexual health messaging. Peer football coaches at Kami Maximum Prison, just outside Bulawayo, share how the program has impacted their health.
Then ngazotesta lapha emlondolozi ngoba kwazi status sami sinjani.
Program itakaiona yakatikoshera zvikuru nekuti nje chinonzi bhora chinhu chinokwanisa kuunganidza vanhu tobva tatanga kuvadzisa nepamusoro pekutapurirana utachiwana kuti usatapurwe kana kuti uzvidzivirire ungaite sei. Takasvika pakuvadzisa kuti aiwa munhu wese anonzi musikana kana kuti munhu wese anonzi munhurume iva munhu akavimbika pamunhu wani, uye kana uri munhu anoda kubata usarege kushandisa wakazvidzivirira panyaya yebonde. Then kana kuti makagara mumba musagare muchirwa zvokuti vanhu munoi muchingonetsana, vanhu vodzimara vakutotiza. Saka program iyi tinoifarira zvikuru.
It changed a lot because I was not aware about screening things such as TB, STIs, HIV. So this time I almost go for VTC most of the times.
Volunteering as peer educators gives inmates skills for life and new attitudes and hope for their future.
I never knew that beating women was wrong. So now I know. And the impact that it had on me is that I'm going to live well with those people now. Now I know how to balance gender now.
Simba Guja, an official at VSO, comments on the future of the program.
The aspiration for VSO is to cascade the model for football for youth to target more inmates and ex-inmates within our prison settings in Zimbabwe, Malawi, and Zambia, where we're looking at issues of sexual and reproductive health, gender, and also issues of HIV and AIDS.
A recent evaluation found ART adherence rates doubled from 50% to 100% at Chikurubi Maximum Prison in Zimbabwe since the program started. Over 10,000 inmates now have increased access to health services. Prison services reported that the program has reduced reoffending rates and also improved the mental well-being of participating inmates.
There should be a continuous training of our patients since they come and go. you realize that at some times we are left with very few knowledgeable cadres or those who are self-driven.
The evaluation showed most inmates have changed their thinking around gender, with 94% now reporting that gender-based violence is never justified. The program has demonstrated the power of football to drive change amongst some of the most marginalized and challenging of key populations.